normal population, when you're not trying to deal with trauma, it can be a lot of fun. It's very peaceful, and you feel tremendous trust and tremendous safety. But for people doing the trauma work, all they do is feel safe enough. It's not fun for them, but it is safe enough that they are, in the course of the therapy, able to bring up memories of their traumas, and they can actually feel them being moved to other parts of their brain. This is not, by the way, just about the drug. As I said before, it requires a sense of safety. It also requires a deep sense of trust, and that requires a very strong alliance with the therapist. So the way the Mitthofers and other people who are approaching this do that is with a non-directive type of psychotherapy. They do not have a protocol saying, now you must start telling me about your trauma. On the contrary, since I didn't say this earlier, but no acute trauma, or almost no acute trauma, arises without a history of some kind of either family trauma for that person or childhood trauma. Those are the people who are susceptible to developing it. And when you use this kind of psychotherapy, you don't know which parts of that story need to arise first. If you go straight to the trauma of an IED bomb that exploded or whatnot, you may not get there. So you have to allow the patient, very often in long periods of silence, to go inwards and see what is arising. And out of that, they're able to recall what they need and reconsolidate it to other parts of the brain. The Mitthofers call that the inner healing intelligence, which again, after I was fortunate to do a training session with Michael and his wife Annie in Charleston, South Carolina, where we watched probably 12 hours or so of videotape of people undergoing the therapy. And you begin to believe that there is an inner healing intelligence. People will go in, you don't watch the hour that they're silent, of course, but you see there's a gap of an hour, and out of that comes this intense